Hey folks, Dr. Venkata Krishnan here. I welcome you all for a simple concept in biomechanics from orthodontics, that is center of resistance. So to begin with, let us understand what is center of resistance. So center of resistance is a point on the tooth through which when we apply a force, the tooth moves bodily from one place to other place. So when we apply a force in this direction, the tooth just moves bodily without any tipping. There is no tipping, there is no rotation, no movement at all. Just the crown and root moves in the same direction along the direction of the force. That particular point is called as center of resistance. Alright, fine. Why we should know about the center of resistance? Because in clinical orthodontics, there may be in some situation that where we need only pure bodily movement rather tipping or rotation. So that's the importance of center of resistance, number one. Number two, the center of resistance, that point is actually a constant point. It doesn't change from one time to another time. If the point is located, that point is constant throughout. Fine. But there are some factors that will lead to relative change in position of center of resistance that we will be seeing in the upcoming sessions. Fine. Now, having said this, let us get to know where this center of resistance point is actually located. For this, Dr. Profit had clearly said that for single rooted tooth like incisors, canines, okay, for single rooted tooth, center of resistance lies somewhere between 1/3 to 1/2 of the root surface from apex to alveolar crest. Very, very important. So that point is located somewhere between 1/3 to 1/2 of the root surface from root apex to alveolar crest. So if this is the tooth, and let us assume this is the alveolar crest. This is the level of alveolar crest and this is the root apex, right? In this distance, it is located 1/3 to 1/2 of the root surface. So somewhere here. So this is the location of center of resistance for single rooted tooth. Now, in case of multi-rooted tooth, something like molars, they are situated, like for example, if you take maxillary molar, they are situated 1 to 2 mm apical to the furcation. The same thing applicable for mandible molars as well. So just to quick recap, number one, for single rooted tooth, it is located 1/3 to 1/2 of the root surface from root apex to alveolar crest. Whereas in case of multi-rooted tooth, it is located 1 to 2 mm apical to the furcation levels. Now, as we discussed, I have mentioned this particular point is actually constant. But there are some factors that might relatively change. It is relative change, not an absolute change. It might relatively change the position of center of resistance. And those factors could be, number one, crestal bone loss due to some periodontal condition. Number two, it could be because of root resorption, right? Let us see one by one. So, for example, for crestal bone loss, let us assume we are having a tooth here, and for some reason there is a crestal bone loss. Okay, so this is a level of crestal bone loss and this is the root apex. So whenever there is a loss of alveolar crest, what happens to center of resistance? We know definition that it is 1/3 to 1/2 of the root surface from root apex to alveolar crest. So in this length, the center of resistance between 1/3 to 1/2. So meaning what happens here is, compared to the normal healthier tooth, the center of resistance of the crestal bone loss or the tooth which is experiencing some active periodontal condition, the center of resistance would have shifted apically. So this is an important point to remember. The center of resistance shift apically in case of crestal bone loss. Right. Scenario number 2. So now we are having root resorption. For example, this is a level of root. So there is no proper apex. But we are having socket here. But here we are having proper alveolar crest. So as per the same definition, it is always between 1/3 to 1/2 of the root surface from root apex to alveolar crest. So whenever there is the loss of root length or height, what happens to center of resistance? It shifts coronally. So compared to normal tooth, in case of root resorption, the center of resistance shifts coronally. Alright guys, so let's just recap. In case of normal and healthier tooth, the center of resistance is located somewhere between 1/3 to 1/2 of the root surface from root apex to alveolar crest, number 1. Number 2, in case of crestal bone loss, the center of resistance moves apically, whereas in case of root resorption, the center of resistance moves coronally. So these are the conditions that might relatively change the position of center of resistance of the particular tooth. Okay guys, I hope this simple session was very useful for you. I will see you on the next video. Until then, see you. Bye bye. Jai Hind.